Hello, my name is Axel Achade, and this presentation is called COVID-19 Interdisciplinary Pandemic Response. This is for the Public Health 858 course, One Health for St. George's University School of Medicine. So this is a table of contents, and it lists all the different subjects that I will be discussing in this presentation. First, we're going to discuss the case study and the timeline of events. So on December 31st, 2019, China reported a cluster of cases of pneumonia in people associated with a seafood market in China province. By January 7th to 2020, the Chinese authorities confirmed that this cluster of pneumonia symptoms is associated with a novel coronavirus, now called coronavirus 2019. The data show that there is person-to-person transmission that is occurring, and this is different from before, in which the transmission was thought to be from seafood. By January 20th and the 30th, we are having cases in the US. And then by the 30th, you have 9,976 cases that are reported in at least 21 countries. By April, there's 2.7 million people affected, and over 194,000 deaths across 185 countries. And by June of that same year, you have 6.75 million people confirmed with this virus, and over 393,000 deaths across 210 countries. It's important to understand what is a transmission of COVID. And so what we understand is that these individuals are getting affected and they're presenting with flu-like symptoms, coughing, sneezing. And when they are talking and sneezing or talking, they are emitting aerosol viruses, particles into the air, and also droplets that can be transmitted either through feces or ferments, which is like contaminated surfaces or objects. And it's going to person in transmission. As you can see from this graph, this is serious because it can easily affect households, which will spread into communities, go into vulnerable housing situations such as senior living institutions. And then from there, it crossed borders and went into different countries to create the pandemic. Before I start talking about the different healthcare roles and their response, I think it's important to talk about what is the 4 stages of pandemic response. So prior to COVID, there was the World Health Organization released this article on the continuum of pandemic phases, which was highlighting influenza response from 2016. In this article, they talked about 3 main phases, which is inter-pandemic phase, the alert phase, and transition phase, where we'll go back into inter-pandemic phase. With that, they were able to relate that to a risk assessment of what we should be doing as individuals to prepare in this pandemic phase. So there's being prepared, there's the response, and then of course there's the recovery. As you can see over here, there's going to be a slight bump back in the transition phase, which is going to correlate to a second round or new emerging cases coming out in the second round of infections before it goes back down. So to elaborate from this model during the pandemic of COVID-19, they were able to elaborate and create 4 main stages of the pandemic response. And this is according to, again, the World Health Organization. So what they have is that the pre-pandemic stage is considered the initiation period, and this is when you're not going to have that many humans affected. It might predominantly be from animals, and in this state, you might start raising some concerns. Just because of the outlook of transmission that is occurring. Eventually, you're going to go into recognition, and you're going to realize that this is going from human to human transmission. It's very important in this pre-pandemic state to start doing research, doing literature review, and seeing how any other illnesses may present similarly, and how the world has been able to deal with these type of illnesses in the past, and also to prepare for the acknowledge and prepare for the initiation of pandemic assuring across nations. During this next stage is going to be the acceleration state, and as you can see from this graph, it's going to be infections happening at a widespread number across, and it's going to be going in such a high rate that it will be necessary for the government and health organizations to have some type of monitoring in place to make sure that there is epidemiology models that are going to be tracking populations, mobility across lands, the land use and activities. And then you're going to be looking at the spatial temporal scales and trying to see a forecast, per se, of what is coming next so that you can better prepare for this pandemic as it's reaching different borders. Um, as you go through, you're going to go into mitigation, which is going to involve implementing some of these interventions to try to control um, the the outbreaks of this pandemic. So you're going to make sure that these interventions that you have put in place are actually working, making adjustments as you go, and hoping that you can contain the spread of the virus big enough so that it can start decreasing and decelerating. Of course, you're going to have some recurrent events happening. There might be a second wave in this state as well. For suppression, this is when the ideal state is this is when this is the pandemic or the virus spread significantly decreasing into a phase in which it's very well maintained. This is when you will be implementing the vaccines and making sure that it's compliant across the nation, and that there is enough access to this vaccine to help control and contain this virus. You will also make sure that there is contact tracings to see if there's any new variants being created, and making sure that we can try to contain the virus so much so that it would become a seasonal event, as explained here. And so that will be when you have finally reached complete suppression. In this presentation, I will be highlighting 6 interdisciplinary pandemic responders and how they're going to respond to a pandemic such as COVID-19. The first one I will be talking about is the World Health Organization, and then I will follow through with the Prime Minister or the President of the nation, and then the Secretary of Health, the Surgeon General, or also called the Chief Medical Officer, the Secretary of National Security, and also the Secretary of Finance. So starting with the World Health Organization director, you are the duties of this of this director pre-pandemic stage is going to be collaborating with natural health organizations, providing guidelines and recommendations, and using a scientific based method to back up your implementation of policies. You're also going to be facilitating international cooperation to combat the pandemic. During this pre-pandemic state, again, you're going to be monitoring and assessing the outlook of the situation. So what we know so far is that this is a highly contagious illness emerging from China. So you're going to do everything possible to track this. You're going to be researching to see what the spread of new variants are, emerging hotspots, and understanding what the impact of this type of illness is for the public health. And this is going to be using data sets that you will be creating using epidemiological um, science behind it. You're also going to be providing timely and accurate information to the public and especially to different countries, the leaders of different countries, helping them to provide regular updates and guidelines to the public so that they can understand how to better control this within their countries. And it's very important that you're also providing guidelines in this pre-pandemic state for travel restrictions and trying to get as many countries as possible to abide by international health regulations. So the next thing is that we are right here. We are in a pre-pandemic state, and we are about to declare that this is this is an international concern. So this is the declaration of public health emergency of international concern. This will be declared by the WHO organization, and this is the highest level of alert globally. They are going to signal to all countries all around the world that they need to prepare for the potential arrival of the virus to their borders. And this is also in efforts to get countries to start collaborating and coordinate efforts to especially assist and respond to those countries that have been highly affected, which, as we know early on, a lot of Asian countries were highly affected and had these outrageous death rates. And so other countries, such as the US, were able to come together and provide assistance as needed with equipment and health resources for these countries. The next state is going into acceleration and mitigation. As the World Health Organization, you're going to be coordinating these global health efforts. You're going to be meeting with leaders of countries, international organizations, and the stakeholders to share information and best practices and resources. This is going to help distribute medical supplies such as the N95 mask, and financial and human resources to the countries that are most in need. You're also going to be providing technical support to try to help them, these countries, address the pandemic efficiently. So this will be giving them guidelines on contact tracing, social distancing, quarantine measures, hygiene practices, helping them with the healthcare infrastructure and also public health messaging. And of course, continue monitoring and assessment of the pandemic is needed just to ensure that you are identifying hotspots, making sure that you let the public know about infection rates and then also the new variants. And then you will adjust any strategies or policies that you have made accordingly to what is happening in these different countries. Once you reach the suppression state, Well, first we need to reach the suppression state, and the way that we do that is by collaborating with research institutions, and then advocating for equity and access to healthcare. So, what is important during this time is that we need to find a vaccine. We need to find a way to control the the new variants from mutating. So getting a vaccine is the best way. So providing the clinical trials, the data sharing initiatives, and the vaccine development so that we can initiate some research partnerships across country borders. It's also important to advocate for equality and access to care, which is important because once the vaccine is developed and able to be distributed to the public, you want to ensure that the distribution is fair regardless of income level. And the COVAX facility with the WHO organization was able to kind of facilitate some of these uh, these guidelines to make sure that vaccines and treatments and medical supplies was delivered equally across nations. The next discipline that I will be talking about is the prime minister or the president of the organization. So the of the nation, I should say. So the pre-pandemic phase is important um, talk to the different um, different healthcare entities to make sure that that you as the leader of the nation understand what is going on so that you can best advocate and communicate and educate this to the public. You're going to be providing the public and reassuring the citizens that they need to abide by the healthcare protocols. You're also going to be declaring a state of emergency for the country. This is also going to help to improve emergency funding and resources, and also to enforce the travel restrictions as we talked about before. Another thing that you will do for the nation is to um, collaborate with government agencies on a government response. So that includes establishing a task force, a committee to oversee what is happening and collaborate with all the stakeholders. The next thing that we would do is to move into the Federation immigration phase as the head of state. This is important to implement policy changing and the changes in making of new policies and implementation into the government. So this is making sure that we have very strict policies for lockdown, quarantine measures, travel restrictions, and social distancing guidelines. Um, this will be making sure that you are approving and advocating resources for healthcare systems, also for vaccine development, distribution, and then, of course, continue monitoring and assessment. This is when the president or the head of state is going to be relying heavily on experts to help them understand, what these infection rates, hospitalizations, mortality rates mean, and how is that metrics going to better help and assess aids for all the citizens. Additionally, you're going to provide support for healthcare workers. This includes providing protective equipment for the healthcare workers, ensuring that they are safe and efficient in their work, and also engaging in international cooperation, diplomatically, making sure that all these different countries are working together to supply the medical needs and equipment to the countries that have been greatly affected. The next thing the president or the prime minister is going to do is to evaluate their role in the suppression. To encourage suppression, they will need to be heavily involved in making sure that there is a vaccine involved and immunization campaign in place, making sure that there's a distribution of vaccines to everyone in the nation, prioritizing high-risk groups, elderly, people who might be immunocompromised, to receive that vaccine first. You're also going to make sure that there's economic management and relief. And this is going to help to stimulate the economy, financial assistance programs to people who are in need because they were not able to work because of social distancing protocols. This is also going to help to develop and understand the long-term plans for the nation, how to rebuild the economy, how to straighten the healthcare systems that were devastated from the pandemic. The next, the next discipline that I will be talking about is the Secretary of Health and Human Services. So their duties include coordinating with the federal government to respond to public health emergencies. So under the umbrella of the Health and Human Services, you have the CDC, which is the Center of Disease Control, and disease control and prevention. And then you also have the Food and Drug Administration with the FDA and the National Institute of Health, which is where a lot of the research, medical research occurs. As a Secretary of Health, you are going to be hard at work during the pre-pandemic state. You're going to be looking at past literature, looking at clinical investigations, as there's more reports of the pandemic, of the virus emerging in different countries. You're also going to help to put in place these travel restrictions, and make these early reports that can be um, shown to the president of the nation so that they can better understand as well what is going on. During the acceleration state, as I mentioned before, the WHO organization is going to declare a national state of an emergency, a worldwide state of emergency. And as the Secretary of Health, you are going to advise the president to to declare a formal state of emergency for the nation so that you can start mobilizing networks and understanding what is going on with this virus spreading. You're going to enforce some of these public health strategies, epidemiological um, strategies to help to predict forecasting for the pandemic, and see where and how the virus is spreading throughout the nation. For the mitigation state, this is looking at all the interventions that you have put in place, seeing if there is anything that you need to, um, review or adjust for these interventions to be properly analyzed to see if they are truly effective for the nation. You're also going to really have a big focus on the healthcare resources demands, making sure that hospitals have capacity to control any outbreaks within their communities. You're going to be sharing protocols and health logistics with all of these hospitals so that it can be a smoother um, process for everyone. In order to initiate the suppression state, you will be initiating the contact tracing, contact investigation, and exposure notifications, and making sure that it's mobile so that everyone can have access to this. You're also going to be advocating for vaccines allocation, prioritizing the different groups that need this, and also overseeing the production schedule for this as well. The next discipline I will talk about is the Surgeon General, also called the Chief Medical Officer of the nation. So in this role of the Surgeon General for the U.S., you are the nation's leading spokesperson of matters of public health, and this includes basically holding the highest ranking position of the U.S. Public Health Services Commission Corps, and that you will be directly the providing assistance to the assistance of the Secretary of State, Secretary of Health, who will be providing as the advisor to the Secretary of Health and Human Services. As a Surgeon General, you need to be activating the emergency preparedness and response, which is in the pre-pandemic state. And this will be to make sure that you are prepared for any infectious disease outbreaks, natural disasters, and other public health threats. Um, as you approach the acceleration and migration state, it's very important to understand that how policy development and implementation occurs. So you're going to be advising all of these high-ranking government officials, such as the president, the Secretary of Health and Human Services, and other government officials, to really make sure they understand other measures to put in place for social distancing, mask mandates, quarantine protocols, and you're going to be helping to distribute this information to the public. You're also going to make sure that these hospital facilities are having adequate PPE, which is personal protective equipment, as they're working with these patients, and then also testing for diagnosis and medical supplies as well. You're going to be monitoring and tracking the spread of COVID-19 over these different hospitals. You're going to be looking at trends through hospitals and um, hospital hospitalizations and deaths. You're also going to be looking at crisis management and risk communication. This is going to provide leadership and communications for the public about evolving situations, including any changes to guidelines and recommendations. The Surgeon General's role is and suppression is making sure that there is health equity to vulnerable populations. This is very important to making sure that the government is able to address any health disparities that we see within racial, ethnic groups, communities, and then rural populations. Making sure that they have access to the healthcare facilities and also mobile testing clinics. So you will implement interventions such as mobile healthcare clinics, community outreach programs, and then also language accessibility resources. Um, and then lastly, you're also going to have a really big focus on research and development. Again, the way that you can reach suppression state is by making sure that the virus is contained through vaccine application. So we need to have treatments and vaccines development. We also need to address any gaps of knowledge and inform the public of decision making um, for better decision making skills. We're also going to make sure that we understand any health and long-term effects of this virus to the public. So for national security, this is the Minister of Minister or Secretary of National Security. This is pre-pandemic state in which they will have duties, which include responsible for creating and uploading national security policies for the country, and outlining priorities and long-term goals to protecting the country. The key branches include defense, intelligence, counter terrorism, cybersecurity, diplomacy, and nuclear security. So the coordination of natural response efforts include state and local governments, as well as international partners that will ensure cohesiveness and effective response strategies. So for this, you will also have the duties during acceleration and mitigation phase for the Secretary of National Security. So it will be important for them to have border control and immigration management. They will be overseeing measures such as travel restrictions, screening procedures, and quarantine protocols for incoming travelers at the border. It was also critical for them to implement infrastructure protection, and this will be such as in healthcare, transportation, energy, and communications. They will be in charge of cybersecurity, making sure that there's no threats to healthcare systems, government institutions, and also dispelling some of the misinformation out there that is through the internet about the COVID-19 vaccine. They will also be in charge of activating FEMA, which is the Federal Emergency Management Agency that will assist on the state and local governments with medical supplies, personnel, and funding to the areas that need it most. And the role of suppression for the Secretary of National Security includes including their national intelligence tactics to monitor ongoing cases of COVID-19 globally and ensure that new strains of the research as soon as they're identified. They will also continue to support with contact tracing and making sure these airlines and border control personnel are still being pushing the COVID-19 screenings as the pandemic winds down. They will continue collaborating with other nations and health agencies like the WHO to implement best health practices and initiation and combating the pandemic. And last but not least, we are going to talk about the minister or the secretary of finance. So the important role for them during the pandemic state is to conduct assessment of understanding the economic impacts of the pandemic as it's potentially emerging across the world. This will include data analysis of GDP growth, unemployment rates, revenue projections, and various economic indicators. They're going to also be in charge of creating a budget to reallocate resources to prioritize healthcare and social services nets and economic recovery initiatives. During the acceleration and mitigation phase, they are going to be formulating economic response plans. This includes stimulus packages, tax relief measures, financial assistance programs, unemployment benefits, and other policy interventions. They're also going to be monitoring and adjusting their policies as needed as the pandemic progresses over months to years. And they're going to be communicating with the stakeholders. This includes the businesses of financial institutions, labor unions, and also the general public, just to update them on economic policies and the response efforts. And last but not least, you will have the suppression state of the Secretary of Finance. So during this state, it will be important to implement this discussions on an international level to um, to make sure that every country is cooperating and understanding the economic devastation that the pandemic could have inflicted on their countries and working together to resolve and restructure their countries as the pandemic winds down. They're going to be supporting businesses and workers by by providing loans and grants and wage subsidies. They're also going to make sure that there's unemployment benefits that are going to affect both the individuals and the businesses that were highly affected by this. This is my references, and this concludes my presentation on COVID-19 response with the various interdisciplinary response COVID responders. Thank you.